Scleral contact lenses can help in complicated corneal cases. The purpose of this presentation is to show that the use of this kind of contact lenses can correct height refractive errors in patients with irregular astigmatism, improving their visual quality. The diameter of this lens is 12.7 millimeters. As it is wider than the corneal width, improves comfort and avoids rubbing over the sclerocorneal limbus. These lenses have three different parts: a 6 millimeters spherical central zone, an spheric transition segment, and a scleral support band. This allows comfort and better visual quality in these patients. These lenses are slightly wider than the cornea, and this is why we call them semi-scleral. In this first case, we present a 36-year-old woman with pseudophakia and corneal graft. We can see the perfect centering of the lens in the right eye, which allows a visual acuity of 0.1 logmar. In the other eye, a rigid gas-permeable contact lens is adapted. There is a small bubble under the lens because the cornea is flatter. The second case is a young girl with corneal ectasia after a LASIK procedure. Centering is good, but the edge of the lens is elevated, causing discomfort. Visual acuity with this lens was 0.1 in the right eye and 0.05 logmar in the left. In the following case, a semiscleral contact lens is adapted in a man with a previous radial keratotomy in the right eye and PRK in the left 20 years ago. We can see radial incisions and central haze in the fellow eye. First, we try the adaptation of a hydrophilic contact lens, but the visual acuity was not good. Then we try with a semiscleral contact lens, but the cornea is too flat. That's why there is a big bubble between the lens and the cornea. A modification of the lens finally allows a better adaptation. This is another adaptation in a patient with corneal transplant in both eyes. In this case of keratoconus, a topography-based adaptation is easier and faster. Two last cases, father and son, with keratoconus, 53 and 22 years old. The first had poor tolerance to rigid gas-permeable contact lens, and the second did not have good visual acuity with the hydrophilic lenses. The corrected visual acuity achieved with these contact lenses was better than with spectacles in all cases. The lacrimal reservoir between cornea and lens neutralizes irregular astigmatism and permits oxygen transfer to the cornea.